families of children with intellectual disabilities in Limpopo Province, South Africa. So the background of the study, that will be followed by the aim of the study, the methods, the findings, then the future directions, conclusions, and references. With the background, the economic and infrastructural success plays a significant role in strengthening the well-being of families of children with intellectual disabilities. Most families as primary caregivers require resources to meet the, to meet the complex needs of their children with intellectual disabilities. Families raising children with intellectual disability experience challenges related to their care responsibility, especially in their home environment. Here I'm having the pictures. The first picture, it indicates our country, South Africa, which is one of the countries situated in the Southern Africa. So South Africa is a rural community most of the time, a rural country. It started with the colonization, which showed itself in apartheid that took long. Usually we are the last country in Africa to have democracy. So this shows that in 1994, when people get their democracy, thinking that things will improve. But when you look at the rural community families, they still face challenges of low socioeconomic status in facilitating their caring role for their children with intellectual disability. Even though South Africa is a developing country, got their democracy since 1994, which was the end of apartheid. But apartheid, even though it's not there, people are still struggling for economic freedom, and most of its rural Black families still live in poverty with the lack of resources to meet their basic needs. In South Africa, we do have the Constitutional Bill of Rights that came with democracy in 1996, which indicates that all citizens have a right to access social assistance and secure ecological, sustainable, and economic development, which is a booklet that you see there on the top. Through the Department of Social Development, the country introduced monthly social child support grants and dependency grants for people with disabilities as a means of economic support to sustain their lives. The social grants in South Africa, due to unemployment, it exceeds the salary income in most provinces. The dependency grants in South Africa, it's 2,315 rand per month, equals to 123 US dollars, as you can see that. So it's run by the agency that is called South African Social Security Agency, is the one that is distributing the grants. South Africa, as you can see the picture, we do have the poverty or rural areas and the developed areas, which led to the country still experiencing economic inequality, economic and infrastructure to sustain the existence of urbanization, where people that you see from the bottom picture, which is the areas, they move to the cities looking for employment, leaving most of the families in the rural areas being female-headed households, because the husbands they went to the cities seeking employment. The aim of this study was to explore the economic and infrastructural support needs of rural families raising children with intellectual disabilities in the Limpopo Province of South Africa. The objectives were to explore the challenges of raising a child with intellectual disability, to explore the economic and infrastructural support of families of children with intellectual disability, and to recommend strategies to improve the support of families of children with intellectual disability in the rural areas. So this study was conducted through qualitative research, explorative and descriptive design employed. The population were the families of children with intellectual disability who were recruited through purposive and snowballing techniques because of their vulnerability due to social stigma around the diagnosis of their children. The researcher recruited families whose children were accessing health and education services. And then the participants were members who were directly involved and then who were staying with the children to be able to give their expressions. The research was conducted in the Capricorn District Municipality in the Limpopo Province, which is the economic hub or head office of the province, which has potential economic growth, approximately 80% rural, which has 30 traditional authorities, and then it has mixed cultural beliefs, and then 5 distinct language groups with different races. Data collection included the mothers, 16 mothers, 1 father, 2 grandparents, 3 aunts, 2 uncles, and 2 guardians. The semi-structured guides were used for both 16 in-depth individual interviews and 1 focus group discussion consisting of 10 members, which were women. Data was analyzed concurrently with data collection. The findings from the 2 sets, which is the in-depth individual interviews and the focus group, were meshed, analyzed through, thematic analysis employed, and then assisted with TI software and to generate the themes. With the findings, there were challenges regarding the economic and infrastructural support needed by the families, which led to the marginalization of both the children and their families. 5 themes emerged, which is nutritional needs of their children, housing and sanitation resources, employment opportunities, availability of education and transport services, and access to healthcare services. So with the nutritional one, when we look at the picture, usually the government in the schools, they do provide food schemes for all the learners and the learners in the primary and the higher schools. But however, when during the school holidays, there's no meals on their table. So the problem was that the minute when the child is not at school, that is the challenges that they will find when they cannot meet their nutritional needs. Where I can just give example of this one who said, as the head of the family, I try to buy more food for him. The groceries that I buy sometimes finish before the end of the month, but I make sure food is available. Usually they say they buy the special food for the child due to their conditions, because some of them were depending on the soft diets because of their tooth problems. And then one was saying food must always be available and readily because he cannot tell us that he's hungry. So he must just pick up the food and whenever he wants to eat. So with the housing and sanitary services, South Africa is having what we call the Reconstruction and Development Program, where they build houses for the families in the rural communities, but it's a process because it needs one to make applications. But the way complaint was that they could not get the houses on time as it takes time for them to go through the process. And then with the sanitation, they indicated, as you can see, this one is a pit toilets that are used in the rural areas. They build them for themselves. So with the child who's having disabilities, they indicate that one mother said, we dig holes with a spade in the garden and we fill them with soil so that he does not use the pit toilet because they are afraid that the child may fall in in the pit. So most toilets, when you see that, even though the government, they are trying to build the pit toilets for the families, only 41%, 41% at this stage managed to get the toilets. So with the employment opportunities, mostly in the rural areas, they get their income through is either as domestic workers, as you see, the one who's cleaning, or they do the home gardening of vegetables. They sell fruits and vegetables on the streets. And the government also have the employee program where they just give them on contract of maybe 6 months, and then they give them stipend for that. So that is what they depend on, especially in the rural areas, because there's no industries there. So usually the families, they complain about their finances, especially the school transport, to say they pay money for that. So they cannot, because they need money to pay for that. Usually because of the situation of the child, they say the transport fetches the child at 8:30, bring him home at 1600, which will be difficult for the mother or to go to work. In most cases, you'll find that with the employees, we know the coming time, it can be 8, or then the leaving time, depend on the type of the work, it can be 1700. So if the government can pay us a grant, because some of us were working and we have left our jobs to care for the children. So some of the families, they feel like apart from the dependency grant that is given by the social development for those who are caring for the children, feel like they still need more because it's not enough for them. So the average monthly income for the families who participated was 6,000, which is $350. And then mostly from the social support that they get as a grants, and then the social relief, which is given for those who are not working in South Africa, which is just a minimal amount, and then salaries, those who are able to work, and those dependency grants. With the availability of education and transport, if you can see these schools, children are working, most of them, they are working to the schools. And then those that are not working, they are using the transport, which is a private transport. If you can see, usually they will take them to school and collect them. They use the mini taxis, which they pay monthly. So one was saying, paying school fees and collecting my child from school is costly, and I'll not be able to find a job because of taking their children. One was saying, when the child comes back home, they must find the parents being there. And then with the transport, they said they are paying about 280 per month, which is 14 US dollars. And the price keep on increasing with the inflation rate. So for them, it was difficult for them to take some of the children to their school. With the schools, the one that I've seen, those that the children were attending the daycare centers, they said they were paying 150, which is 8 US dollars per month from their pockets. So the access to healthcare with the clinic visits, one said, if you can look at the pictures, the top one, there's a queue always when you go to the facilities, either as a primary or in the hospital. Usually it takes more of their time. They queue for long in these healthcare facilities. That is how they were complaining. One was even indicating that I feel like maybe if there can be a way that they can prioritize their children with disabilities. And there are some other organizations that are providing the mobile clinics to those communities. However, you find that they cannot find the service because they come on scheduled times, maybe once a week. That is how you find them. Even though the country provides free healthcare services to the children under 6 and the elderly, and the primary healthcare services for all those, for free for all, especially those in the clinics, but you find that the queues are always there. The future direction or recommendation for this study is to advocate for the active involvement of families in government and non-governmental sponsors initiatives to enhance their capacity to cope with caring challenges. The policy makers should facilitate changes and the development of new policies to empower families on initiatives to improve their economic status and enhance their coping strategies to promote self-efficacy, especially those that are in the rural areas with lack of resources. More research studies that include the active participation of families and people with disabilities to establish way to develop African countries to strengthen the rights of people with disabilities, to improve the status of the families to achieve sustainable goals towards the economic, health, and social development of families of children with intellectual disability by developing and implementing inclusion policies for family support system, establishing community poverty alleviation support programs, effective monitoring and evaluation of family financial support system. In conclusion, the strategies that can be used actually mostly to empower these families, it can be through active collaboration of stakeholders in strengthening the rights of children and their family. That includes the government departments that are there. We know they do have policies, but usually most families are still left behind. The local municipality, especially when it comes to providing the houses and the sanitation for the families, faith organization to support the families, the healthcare services to say we need to have more so that the families, they don't feel the burden, especially when they do consultation for their children, rehabilitation centers, which were not there, where these children can be there to learn more vocational activities. The educational institutions, even though they are there, most families, they don't feel that their children are safe in those schools. Some is because they cannot afford them. The communities around them to us to make awareness on how to assist the families, and especially more on the diagnosis of intellectual disability or disabilities. The non-governmental organizations that are there and the non-profit organization and the civil society to take part to make sure that the socioeconomic and the infrastructure support of these families are improved. So these are the references, and then thank you so much.
Thank you so much, Professor Modula. What a wonderfully illustrative presentation. We look forward to some questions, comments, and dialogue at the end of our presentations. So next we will have Rachael. So please feel free to share your slides and we'll get to it.
Thank you. Thank you. So I'm Rachael Wanjagua, and I am from Kenya, although right now I'm in Texas doing my postdoc. I just completed my PhD last year from the University of Illinois, Chicago. And part of my presentation today is from the work that I did in my doctoral studies as a disability studies scholar. And the topic I am taking is reimagining research methodologies when conducting research in the African context, which will be based on my research in Kenya. So I'll give a brief introduction, contextualize Kenya, and give an overview of disability and intellectual disabilities, which is usually my main area of focus. I'll give what I did in inclusive research, how we implemented it, the findings, and future directions. So my study stems from the understanding that there is bias in the way research is conducted. When I was sitting in all lectures, listening to disability studies, although it is a global issue, I could tell, having practiced working with people with disabilities and families in the Kenyan context, that disability studies was not really speaking exactly to our experiences, at least in Kenya. And so even the way research is being conducted would only produce certain ways of seeing and viewing disability, which either left out some part of the population, and I decided to focus on intellectual disabilities for this reason. Scholars like Soldatic, Mikosha, they may be in other fields of study, but we know they have also conducted research in disability studies, and they do acknowledge that a global South perspective of disability studies is required. People like Sean Gregg. So because there is an overall, like I said, erasure of what our experiences are. And so when you look at global policies or guidelines, such as the UN Convention on Rights of People with Disabilities, the Sustainable Development Goals, what was there initially, most global blueprints are informed by, I'll use global North or Western studies, outcomes of studies conducted in these areas. And so even though countries such as Kenya use the global blueprints to implement some of the services or works, they really are not perfect. Let me not use the word perfect, but most of the time they will not speak to the lived experiences of the people who are living there. And this is especially for intellectual and developmental disabilities, which is a highly stigmatized issue. And the people who do have intellectual disabilities hardly, at least in Kenya, they hardly participate adequately in education, in employment, with like dignity in their livelihoods. So my research most of the time has focused on this population, families and individuals who have intellectual disabilities. I have also lived with people who have intellectual disabilities for a good chunk of years in my life. I have spent at least 10 years living, and most of the time also providing direct supports to people who had intellectual disabilities. So I am biased also in the way I view and look at intellectual disability. And so I have some confidence in critiquing some of the ways research and the subsequent knowledge that comes from research that focuses on intellectual and developmental disabilities. The aim of my study was to identify services and support needs in Kenya that can focus on this population. Kenya is an East African country. It's bordered by Ethiopia, Somalia, Tanzania, and Uganda. There's also a section where Rwanda, just a little bit, borders Kenya. The study I conducted was in Laikipia, centrally placed in Kenya. And a snapshot of Kenya, the current population from the last census, which was about in 2022, Kenya has about 55 million people. Gross domestic product totals to around 108 billion US dollars. The GDP per capita, according to World Bank 2023, was 1,952 US dollars. The main sources of revenue for government are tourism, agriculture, exports, mining, and taxes. And as of 2023, the government employed only 992,800 Kenyans. This is less than even 1% of the population. 0.18 of the population is employed in formal employment. 85% of government jobs in Kenya are in the education, public administration and defense, and human health and social work sectors. And I give a little bit of breakdown on about how many people The rest of the population really depends on subsistence farming, casual labor, informal sector jobs, small scale commercial farming, and remittances from abroad, which I don't have exact figure, but not really many people rely on this as a source of income. On the other hand, literacy levels are high in Kenya. As of 2022, adult literacy was at 89%, and males, because these are the only two genders by which people are classified in Kenya, male 86%, female 80%, and youth literacy was at about 96%. So 96 male, 95% female literacy of Kenyan youth. Majority of Kenyans, at least 55%, according to a report published in 2022, were able to complete primary education. Primary education in Kenya is like grade 1 to, I don't know the equivalence of the US because I'm not so familiar with the US system. But anyway, we have 8 years of primary education in Kenya, 4 years of secondary school, and then you can either go to tertiary college or university. And university level, very few Kenyans manage to go to university, and part of that is because it's very expensive. But there are so many smart people in the country. In terms of disability, 44% of people with disability usually are able to complete education, but this is not intellectual disabilities. 17% of people with disabilities will also, as of 2009 census, were able to access and complete secondary school. The people with disability who access universities in Kenya are like 1.6%. The same census of 2009 gave about 10.2% of Kenya's population are people who have intellectual and developmental disabilities. 69% of these were enrolled in educational institutions. However, Kenya does not have a legal mandate to provide education to people who have intellectual disabilities. And this is constitutional. It has not, there's a bill that has been pending in government since 2014, but has never been passed to make this mandatory in government. But also the constitution, even though the constitution of Kenya has gone through several reviews, has not changed some of the colonial blueprints that had been left. There's what people usually call the mental disability law or something like that. It was never changed even after, and it was left as such from, Kenya was colonized by the British. And as they left it, intellectual disability has remained the same up to date. So my focus with the population of people with intellectual disabilities, and because I have a lived experience, was to train people who have been diagnosed with an intellectual disability to be co-researchers. But it was impossible to have them as co-researchers because one of the challenges that I will mention was dealing with IRBs, both in the US and in Kenya. Because people with intellectual disabilities are considered a vulnerable population, most IRBs, and the fact that most research studies follow a very strict positivist approach to research, intellectual disability is not really considered a population that will understand research. And so there was a lot of pushback. And at least in the US, they told me the most we can allow you to do is have them as research assistants. So I trained 2 people, Francis and Winnie, to be my research assistants in Kenya. And the program, the local organization that was helping to facilitate the research were kind enough to identify them for me and propose them. We did 2 weeks of like ethics in human subjects research. By the time I was conducting research in the year 2023, there wasn't any kind of training that is usually geared or framed, any curriculum of training on ethics that is, even in the US, that is favorable for use by people with intellectual disabilities. So I had to use what is there, the CITI, city training, translated and used just my own way of presenting it to them with my local language, because they also did not understand English or write. I also took another like 2 months of training research methods. At least there is the field of inclusive research in IDD research is growing, and I used a curriculum that had been developed from by one of the scholars in the UK. And that is, I did reach out to her. She was kind enough to share, and that is what I used for my training. However, it was too technical for people in Kenya to understand. And for this reason, I did recognize that really there's a need to rethink how we conduct research, because both Francis and Winnie were very open and transparent to me, and I needed the feedback from them about how training was. They were calling it very boring for one. But I had to shift from kind of teaching in terms of how class setting, how training happens in a class setting, to always doing hands-on passing on of information through practice. So a lot of engagement with other people outside, inviting them to come and be like the people who we were practicing on, how to interview, how to introduce ourselves. And finally, even to pilot our study with a few parents and people with intellectual disabilities, which was very helpful for me. So like I mentioned, some of the challenges were IRBs. In the US, it is the complete disregard for that people with intellectual disabilities can be co-researchers. In Kenya, it was that, no, people with intellectual disabilities are not receiving the degree, so you cannot involve them in any way other than participants. In Kenya, the other pushback was that they had to be labeled as people with intellectual disabilities. They are not receiving the PhD. So the university that I was requesting to go through my study was not having it. The other pushback was that the ethics committee could not understand how people with intellectual disabilities could understand what research is. However, they also asked me to completely remove them as research assistants or co-researchers, but I did give a pushback because I thought that my study wasn't going to follow a conventional positivist approach. I really needed people with intellectual disabilities involved in it, such that the knowledge that was going to come from this study had the influence and the perspective from the two individuals and others involved in the study. In the community, because after pushback, for sure, I was still eventually granted permission to conduct the research. Going out into the community to conduct our study, most of the time, people were not, they had a set of questions that each of them were asking, only 3 from our whole study. I was asking most of the questions for sure, but you could see how people posed differently when it was Francis asking Winnie and when I was the one asking the questions. What I am calling infantilization and ableist attitudes. At the end of the research, some of the family, especially caregivers, would ask them whether they understood anything about what the questions they were asking. And most of the time I did not need to interject in their questions because they were quite eloquent. They were what you would call borderline for those who understand how intellectual disability is diagnosed. And yeah, most of the time they were not taken seriously. So ours was a qualitative study. We were using interviews, focus groups, and observations. Our participants had to be between 18 and 65 years. We had 10 caregivers, 4 who were male, 6 who were female, and 10 people with intellectual disabilities. They were 5 and 5. All of them had given their consent to participate, and 5 of the people with intellectual disabilities required a caregiver to support them. The interviews were about lived experiences and how they perceived the service needs and the supports that they needed, both at home, in the community, and from disability services. The focus groups, we drew the themes from the interviews, and mainly the outcomes of our interviews and focus group were that what has been known, stigma, of course, so many people complained about the lack of, even those who are in school, the lack of quality education. You could be 40 years old and still in a school setting, but what you were taught were what in Kenya they call activities of daily living. So like wiping your mouth when you're drooling, going to the toilet and wash your hands. So nothing that can translate into later some skills that will help you in either being entrepreneurial, working from home, or yeah, it was just basic and understanding that. In fact, some of the people say that even teachers thought that people with intellectual disabilities were wasting time being in school. There was no system in Kenya for transition from school. So many people, even in old age, 40, 50, were still attending the school that they started when they were kids. If you transitioned to go home, it was back to your home to much more elderly parents without any form of support. And so most of them lived really miserable lives. And the main concern for both caregivers and people with intellectual disabilities was their stability. Another aspect of our findings was that very few disability services were available. And as I gave you context of Kenya, you can see there's very little focus on disability issues, and government doesn't prioritize or provide any. There is providence of some services, but not adequately or not structured in any way that would be helpful for families of people with intellectual disabilities. And as a result, that gap is usually filled by donor organizations. In this particular organization where we conducted research, what we were observing, like people who were very, very poor, were always having visitors from Europe visiting those families. Of course, the houses looked dilapidated and all the time taking photos of such families. And people were articulating this during the study that they usually take photos of us and use that to fundraise. So there were complaints about both the donor organizations and how they relate with service users. The services that were provided are those that were dictated by the donor organizations. And so people were not finding a lot of benefit, especially if it was intellectual disability involved, because for most people who were receiving services from this organization for more than 20 years, nothing much had changed, no progress, no implementation of services that were helpful to them, and they were never involved in decisions about what they wanted with their lives. So on the side of caregivers, what they needed most was information, and empowerment was a very strong theme from among them, because they felt that they need to come to a place where they are the ones who are also asking for which services, how they are implemented, how much donor funding they are asking for, but also so that they are able to advocate for their own supports. So in Kenya, at least, on the side of research, we need to empower people with intellectual disabilities and caregivers to understand disability from different lenses other than a deficit perspective, because you mentioned disability studies, you mentioned disability in Kenya, the first thought that jumps into mind, or a problem or a medical issue that needs to be resolved. So we know as disability scholars that this usually disadvantages people with intellectual disability or disability in general, when people think that you need to be changed for you to fit in the mainstream society. Two, to encourage people with intellectual disabilities and caregivers to be critical about the systems and issues affecting them in Kenya, because having a critical mind would enable them to advocate strongly for the issues that were important for them. Community organizing, in my own perspective, was necessary to start changing issues, developing models of disability support system that focused on lived experiences, at least in Kenya, and to implement and evaluate those models. So on the side of research methods, I thought that as we interacted with the participants in the study, one of the ways that was quite fruitful in gathering data and having the sessions being very informative for everyone was kind of like storytelling when we met for our focus groups. So everyone had an opportunity to tell their story, to feel respected, to feel listened to. And so even research methods, which are not really just Western whitewashed kind of approach to research, didn't seem to be a perfect fit for such a context. So training people with intellectual disabilities, caregivers, on context-specific research methods, advocating for the use and adoption of context-friendly research methods, because when we conduct research in these ways, is it acceptable elsewhere? Can we speak that this is research? So there is need to not only train, but to advocate for these methods. Advocate for advisory councils in ID research in African contexts, so that the voices of people with ID are receiving much more importance and respect that they deserve. And also building community awareness on the issues affecting families and people with intellectual disabilities. And that was the end of my presentation. I hope to hear your thoughts and reflections and questions later. Thank you.
Thank you so much, Rachel. That was a wonderful presentation. Greatly appreciate all it is that you've given us to think about. So now we'll transition to some questions and answers and just take some commentary from the audience and our participants today. So just to get us started, so first we had Professor Juliah Modula, who gave us rare insight into the lived experience of families that are caring for disabled children. And in addition to being caregivers for disabled children, these are individuals who are living in rural conditions. So as you clearly illustrate, these conditions in rural South Africa engenders a marginalized experience within an already marginalized category. So if you could speak a little bit to the gendered dimensions of care. And so you mentioned how it is that women are often the heads of households. And I think that Rachel could also speak to this too, because the photo that you presented of the Gikuyu woman carrying a British colonial settler literally on her back does illustrate the kind of ways that caregiving and that kind of labor is distributed throughout society, and it has its own gendered trends. So if you could please speak to those elements for you both. And also just give us a little bit of insight on what intellectual disabilities are. So we've spoken about them, but if you could just tell us what that might include, so that we can understand the kind of stigmatization that may not come naturally to some people that may not be immersed in disability studies and may not even know what intellectual disabilities are. And I think those are pretty good to get started. But Rachel, your presentation highlights how it is that global guidance on disability through your case study demonstrates that these global guidances of UN and these international bodies are often mismatched with the needs of the populations, in particular to continental Africa and the communities that you worked with in Kenya. So you also speak to positivism. And I think that also a dimension of this positivism, which is an inherent colonial legacy, is who is a source of knowledge and who can contribute. And so these kinds of deeper questions around scholarly activity and what that looks like and how it is that your intellectually disabled research assistants who are capable of being members of your team, but because of the stigma that exists, because of the pressures that are involved with the clearances that are necessary to get them, there were obstacles and hurdles. So just speaking about the sources of knowledge and the kind of colonial, the ongoing colonial legacies of that. And it, to me, you're also suggesting, both of your presentations suggest that these kinds of colonial elements of policy, of law, of conventions, et cetera, cannot be disentangled from what are issues ultimately of white supremacy, which demands that capitalism, as this spectrum goes, how do you contribute to the economy? How do you contribute to the scholarly body? And you have to have a particular way of doing so. And that aside, you have there's the potential to be disposed if you do not contribute to growth. So that's all I'll say. And hopefully you can offer some thoughts and reflections, and we'll also hear from members of the audience.
Okay, I have a question. Can you hear me?
Yes.
I have a question for Professor Juliah. She did talk about improving access to education for children with disabilities. And I wonder, because in her presentation, she did talk about how the challenge really was paying the fees, other than other reasons, which are usually things like accessing the school. And so in my mind, I was thinking about if the children are not accessing, for instance, they're having challenges, even accessing the pit latrine that you showed. How, like, are the schools close to them in the rural communities? How can they access those schools? And how is that also not a challenge, or was it a challenge that they faced, or it wasn't really a challenge? The challenge was just the school fees. And also the stigma element. I was just thinking about all the other challenges that could surround this educational access issue, other than just the fees. But then I was wondering, do those other elements exist or not? The only challenge is just the access to having like finances for education.
Thank you for that. And if there are any other questions, we can take them now as well.
I had another question for Dr. Rachael. In your recommendations for like people with intellectual disabilities, I was wondering if there was also an internal push for them amongst themselves. Like, I know as a researcher, you get into the community as an outsider, or like, I'm saying outsider here, just saying you are the researcher, so you're coming from the outside, regardless of like the experience or your interest that you had attributed to in the beginning of your presentation, and your biasness. But as an outsider, is there any push from the inside to access all the things you recommended in the end? Like, is there any push from the inside as well? You using those two research assistants and how they are helping, and how they themselves have had intellectual disabilities. So is there any push from the inside as well, especially giving the examples of the research assistants?
Phenomenal questions. Thank you so much. So we'll just go in the order of Dr. Modula and then Dr. Wanjagua, and then you all can respond.
Thank you for the question. It's a good one. With the schools, usually the schools that are there, you find that in the provinces, they've got only 3 schools. The schools that are having, the problem is that it's a different distance of more than 15 kilometers. And then the ones that are there, usually they're the early childhood development. The parents don't want, most of them, they don't feel comfortable if they have to send their children there, because it does have a boarding school. They don't want their children to be there. Most of them, they'll tell you that if they take them there, because of the condition of the child, the teachers keep on calling them to say, come and fetch your child, she's not well, she's sick. You find that because of the lack of those schools, they are not there, there's no school around them that they can feel like, I'll take my child to home and then collect her during the end of the day. So the early childhood that are there, some of them, they try to, especially the daycare centers, some they indicate them as schools. They try to accommodate these children. But unfortunately, because these ones, they are not for free, unlike those that are far. Even though they are free, they cannot take their children there because of the transport and other things. But the ones that are here, because these people, they don't have, they are not funded by the government as free education for those children. That is where the school fees thing come in. That is where they pay to say, because we are not funded, most of them, they were still under the development of being accredited by the social development before they provide the grant for the children, for the schools. That's where the problem comes in with the payment of the school fees. They will take them there, but some were worried to say, even though we take them, we pay the 150, doesn't give us the benefit. Yes, because those schools are not the normal schools that for the specials schools that the children with disabilities can use. Thank you. I'm not sure if maybe I did answer your question.
You have, thank you. Thank you so much.
Thank you.
Yeah. Well, to respond to a couple of questions that I received. Yes, in Kenya, care is very gendered, and most of the time it's the women who provide care. But the media has started giving spotlight to this issue, especially when it comes to care for people with disabilities. And there have been dad groups that have been on major media outlets speaking about it. It has not changed the mentality, but hopefully this way of speaking about it in public can start changing discourse around the care. Regarding positivist approaches and the effect they have on whose knowledge, who produces the knowledge, I think that's an area that requires much more research in Kenya, and that's why going off from what we did in terms of intellectual disabilities and some of the wisdom we gleaned from that, I think there's need to also start like believing in our way of knowing, in the way of people with IDD knowing in Kenya, and using those frames of thought, frames of mind, drawing from ways that were already discarded as not being as not being ways that can provide literacy as it is understood by the rest of the world, and focusing on those ways to help us understand the knowledge that needs to come up. And so I still think that this is an area where we need to focus more, not just disability scholars. I think even more fields which will do a better job than I would as a disability studies scholar. So forming partnerships with different scholars from different fields. Regarding whether there's a push, an insider push from people with intellectual disabilities, I think, as I mentioned, that if people become more aware, have a critical way to look at what their lived experiences are, I did see, at least from the research groups and participants, even from our focus groups, people spoke a lot because there was kind of exchange of knowledge in ways that people were thinking about for the first time. And so community organizing, forming advisory councils, like we recommended, is a way that will give rise to this. It is currently not as strong in Kenya, but it is something that hopefully, once people become much more aware about it, it can grow. And that is the hope for the future. Yeah.
Any other questions from the audience? Okay, and if we do have just a few more minutes left to the panel, if Professor Modula or Professor Wanjagua would like to give some just final thoughts on your presentations and the conversation that we've had today, we welcome them, and then we will close.
I just want to say I'm grateful for the opportunity to speak, one, about disability as an issue to discuss in a Global African Conference, and also like food for thought, whether in Global Africa contexts where it's not as developed, like disability is an issue that is usually considered as an afterthought after the rest of services, the rest of the population has had their issues solved by governments. I think it's food for thought in context where this is happening in tandem. Like we can tell in Kenya, it's not just a disability issue. There's even a larger crisis within governance, but there's also an issue. You cannot disregard disability, especially forms of disability such as intellectual disabilities. And yeah, I also remember Dr. Harrington had asked us to speak about intellectual disability. It is, how do we develop this and not disregard a population just because of who they are? And now that I have remembered that you had asked us to speak about intellectual disability, I'm usually uncomfortable to share what science says intellectual disability is, especially because psychologists developed ways of assessing intellect that only favors the majority. And so the group of people labeled intellectual disabilities are the group which do not fall within the normal bell curve. And so they have been disregarded for long in developed and underdeveloped worlds. But we, critical scholars such as myself, acknowledge that there are forms of intellect that are usually not assessed, because currently it is whoever has needs or limitations in adaptive, social, and practical skills, which I don't think all our intellect culminates to only this, having these limitations in these areas of cognition. So I do think there is need to push against diagnosis. And on the one hand, yes, we can argue for a way of people who are labeled with an intellectual disability to also be seen as part of the many. But the fact that people who are labeled with intellectual disabilities require supports, which if you do not highlight that, then they're taken away. It's still food for thought, I will say. But we are here, we are grappling with these questions at the moment, so.
Thank you, Professor and Professor Modula. Just about 2 minutes.
Thank you, Prof. You know, when Dr. Rachael is talking about intellectual disability, you know, I ask myself, because really, when you look at the research, the publications, you talk about South Africa, I think you are able to identify that there's a gap. Really, I don't think, especially the academics and the researchers are at the level of, especially when it comes to talk about the Black disability, I feel like maybe we should open up and then be free to talk about this, especially how they are related to poverty and other things, because I feel like we don't want to talk about them. And then people, yes, interest is there, but it's not like any other discipline. So that's my word to say. Once you talk about disability, people feel like, they feel like you are insensitive. So it's a discipline where we need to talk more about it and then empower each other as we do. Thank you so much for inviting us. Thank you.
And thank you all for a wonderful set of presentations. Thank you for joining us, and we hope that you enjoy the rest of the conference.
Thank you.
Thank you all for a wonderful presentation.
See you all at the next one.